it's HJ from Amidas Touch Med Spa. I am a nurse practitioner and I wanted to take the opportunity today to discuss with you about venous disease. So a lot of times we get clients into the med spa looking for treatment of their spider veins, and I wanted to discuss with you why we get spider veins, how we fix spider veins, what happens after we fix spider veins. And in order to do that, we need to start with why we get spider veins. So, in your body, you have arteries and veins. Arteries take blood from your heart and deliver blood to your legs, while veins take blood from your legs and deliver blood back up to your heart. In your legs, you have two types of veins. You have your deep system veins, which are white on this picture. We don't ever touch those. Those are your main pipes. We only work on what is called your superficial venous system, which are all these purple veins on the picture. And what happens is inside all of your veins, you have valves. And what valves do is they push blood up to your heart, snap shut, and they are not supposed to let blood go backwards. But over time, the valves themselves get weak and fail, and then nothing's stopping the blood from flowing backwards, so it does. Due to gravity, the blood pools in your legs, it causes symptoms, and over time can cause changes in the veins. The reasons why the valves themselves fail are due to estrogen, prior pregnancies, genetics, gravity, injuries, and weight. While you can change some of those things like weight and avoid injuries, you can't undo gravity, you can't change your genetics. We have estrogen in us because we're female. So that is why this is a chronic and progressive disease and lifelong, which means even after we fix the problem, you're still going to need to follow up with your provider once a year for a checkup. The misconception with this disease is that people think you have to see veins to have vein disease, and that is not true. You can have vein disease and not have a single vein on your legs, but in time, the disease will start to show itself if it remains untreated for too long. So think of this disease much like a leaky pipe behind a wall. A pipe can drip and leak for days, months, or years, and you don't know it until you see the stain on the wall. But to fix the stain, you can't just plaster and paint, or else you're gonna keep having this reoccur. You need to fix the pipe behind the wall. Then you can fix the wall itself. And like any building with pipes, life of the building requires maintenance of the pipes, and that holds true for this disease as well. So the way that we treat this disease is that you need to obtain an ultrasound, because that ultimately is going to determine which veins are failing, which ones are not, and if you have vein disease. For veins that are failing, they can be treated with heat called a thermal ablation, with glue. There's a new technology out there where there's aliquots of glue that are placed and the veins actually sealed shut, or with traditional phlebectomies where they cut and pull the vein out, or ligation. When treating spider veins, because that's what we're focusing on, we typically use a medication called polydocanol, and it depends on which veins you're treating that you would use polydocanol on and which strengths. They used to use a medication called hypertonic saline, which some people found to be effective, but mostly people didn't find it to be too effective because our bodies have saline in it and it wasn't as effective, but also because often the problem, which was on the inside of the leg, was never being addressed. There's an off-label use for epinephrine with glycerin, so just be aware of that. Anytime though that you get vein disease treatment, expect to be wearing compression stockings. Compression stockings are important with treatment because what it does is it keeps everything nice and tight, and when you're closing down veins, and you won't run out of veins, but when you're closing down the veins, the ones that aren't working, they don't instantaneously turn to scar tissue. So you need that compression on those veins to ensure that they don't recannulate or open and that you're getting the effect of the treatment. Again, it's been so great teaching you about vein disease today. If you have any questions, please leave them in the comments. We'll do more videos about more specifics in vein disease, and be sure to follow us at Amidas Touch Med Spa. Thank you.